Hi guys, if you're dealing with pain on the inside of your elbow, your medial elbow, make sure to stay tuned in this video because we're going to go over some of the things that you can do and some of the things you can consider if this is something you're dealing with either as a throwing athlete or just in your daily life. Maybe you're weightlifting and you're getting pain that's coming up right into that bone right on the inside of your elbow, or maybe even more towards the back. So we're going to go over that today, and we're going to go over some exercise interventions as well. Okay guys, so we're going to show you 3 different exercise variations we use for athletes and patients that come in with medial elbow pain, medial elbow discomfort. But before we do that, I just want to talk a little bit about something. If you are a throwing athlete, the most important thing is how you are throwing. You may be weak in your pronator, you may be weak in some of your flexors, you may be weak in your bicep or tricep or rotator cuff, but if you're placing stress on your elbow incorrectly, you can get those as strong as possible, but you still may be predisposing yourself to injury because your sequencing is wrong. You may be putting your elbow in an unstable position. You may be increasing your moment of inertia, which will increase the stress to your elbow depending on how you're doing it. So, like I said, if you're a throwing athlete, you have to have your throwing mechanics evaluated. These can help and should be used in conjunction with some sort of biomechanical training. On top of that, you're also, especially if this is something that's been going on for a while, or based on how the symptoms present, you're going to want to get checked out by either your orthopedic physical therapist. If you're in our area, come to Southeast. If you're in Southeast Michigan, come to us. We'll look at you, take you through an evaluation, or go to your orthopedic surgeon, your orthopedic doctor. And they'll be able to test you. There may be further testing beyond what's needed on the table with valgus testing and things like that to see how stable you are. There may be some need for internal diagnostics, but get evaluated if you're on the borderline. A lot of the people we see aren't dealing with some sort of torn ligament like a torn UCL. They're not dealing with an ulnar neuropathy. So we're able to progress them with exercise, especially with the throwers. We deal with a lot of middle school throwers, high school throwers, and even younger. They're dealing with pain on that medial elbow, little leaguer's elbow, or maybe medial epicondylitis. So we see all of these things, and it's very common that they have tendonitis or some inflammation on that medial elbow where all of those tendons attach, especially from the forearm. So we're going to go into those exercises, but I just wanted to talk a little bit about that so that people who are unfamiliar, if you're dealing with this, this is something you may want to get addressed in a clinical setting, in a medical setting, but we're going to go right into the exercises and show you some of the ones that we would use if somebody came in with medial epicondylitis after we've decreased the symptoms and decreased the reactivity of the patient and brought them closer to where we can progress them onto more difficult and demanding exercises. So we're going to go into those right now. Okay guys, so we're going to go over 2 different exercises and another intervention that we use. So we're going to do an exercise with a TheraBand and a cane where we're doing in a kneeling position. You could do it standing as well. We're going to go over one with a bat that you could do right at the field if this is something you're dealing with. Wouldn't recommend it before throwing or prior to throwing, but would be a great exercise maybe after you threw on an off day, something like that. And then the last thing we're going to show you, which you're going to want to stay tuned for, is a self-functional massage. So we've done videos with functional massage and on functional massage in the past, something we use all the time, and it's something we prescribe our athletes, especially ones who are dealing with soreness in season just from throwing a lot, or are dealing with some sort of strain, sprain, something like that, and we'll prescribe a functional massage routine. I'm going to show you a little bit about that. And eventually we're going to have a functional massage portal on our website would be the plan. That's a long-term goal, but we want to show you a little bit that you can start implementing right now. So the first thing we're going to show you is with a bat. So 5-way bat drill, you can start on whichever direction you want. I'm going to turn sideways to you guys. So I've got the bat tight in all my fingers. Every finger is very, very tight, especially the pinky. It's going to go backwards, wrist flat. I'm in a somewhat athletic position. And from right there, I'm going to go into ulnar deviation, or I'm going to go like that with my wrist while I'm holding it. So I'm bringing that bat up while I keep my wrist flat. So you bring it up, down. Nice and controlled all the way through the range of motion without letting that pinky slip at all. So you shouldn't have that. Should be tight as possible. Obviously, if you choke up, it's easier. So that's number one. So 5 ways, like I said, you're going to do the opposite. Radial deviation out in front, working a different muscle. Every one of these should work different muscle. So important on that one, not to let yourself do a bicep curl. I see people doing it like this. Bunch of different variations. Don't let yourself be lazy on it. Maintain strict form. Only movements through the wrist. All the fingers tight. This one, keep your pointer finger tight. That one's going to get loose based on where the bat is. So pinky finger tight. You're here on number 1. Number 3, the bat's out to the side. I'll move over a little bit. So the bat's out that way, the palm's facing in. Ulnar deviation again. Going that way, keeping the wrist flat, nice and controlled, the full range, nice and slow. And then I'm going to go this way, palm forward, bat in. This one's more difficult than the others. And then I'm going to go through supination, pronation. I can do it at 90 degrees. I can do it with my arm straight. I like to start people at 90 degrees. This one and this one can cause more symptoms. If you're still somewhat reactive, you're still getting pain quite a bit, hold off on ones that bothered, especially ones that put a lot of load on it, like this one and like this one. So here, this part shouldn't bother it. But when it gets into this eccentric, where the bat's starting to fall to the outside and then back until it gets to midline, that may be pretty hard on that medial elbow because that pronator comes up and around, and that's often a source of medial elbow pain, especially in throwing athletes. So you want to be careful with these. Nothing should give you pain or discomfort, but we do need to get these muscles strong. Even if you do have a medial elbow instability, or you have an ulnar collateral tear, partial tear, these are huge. We've seen a lot of kids that have come in rehabbing partial ulnar collateral tears, even a few that wanted to rehab with full tears of the UCL, and we've had some success with all of them, and great success with some of them, by getting these structures strong, because these dynamic stabilizers, these muscles, are going to really, really help keep that elbow stable during the throw and reduce the amount of gapping and distraction. So getting these muscles strong, like I said, is very, very important. So there's 5 variations there. I usually will say 15 repetitions of each, minimal rest in between. You'll go from one to the other. And if you could go through that for 2 sets, that's going to light your forearm up pretty good. You're going to be pretty fatigued after that. But the goal is to get it strong. So if you can do, mix up the repetitions. Maybe do sets of 10. Maybe do some sets of 15. Okay, so now here's the next one. I'm going to wrap this up. I'm wrapping a cane, whatever, doesn't matter. You could use your bat too. I'm wrapping it in the TheraBand, which I have attached up high. Just wrapping it up so it doesn't slide off. Just wrap it a few times around. Don't get snapped. Okay, so I'm going to go down to a knee, and there's a few variations I can do with this, but the most important, or the most common that we see weakness in, is ulnar deviation, which is important because those muscles, like I said, stabilize the elbow. So you can go in kneeling. It's actually more difficult than standing based on the angle of pull. And this is a pretty heavy band. I wrapped it up pretty hard. pretty tight, so it's pretty hard for me. And I'm keeping the wrist stable just like you did on the other ones, but I'm closer to a position my forearm's at during the throw. So you can do it here. I'm coming down. This one's awesome. The bands build a lot of strength at the end range. I'm really working hard to keep that pinky tight. And I can vary it. I can go up into a lunge. Easier here based on the angle of pull. The kneeling is pretty difficult. So there's 2 different exercises. In fact, really 6 different exercises, but 1 set with the bat, 1 with the band, and there's other things we can do with this. And we're going to show some more advanced forearm exercises, but for the purpose of this video, medial elbow pain, we're going to want to keep it pretty basic and master these. So if you can do the exercises perfect, you don't need as many exercises. But we're going to cut right now, and then okay guys, so you've seen some of our exercise interventions. I want to show you our functional massage component, or a little bit about it, and okay guys, so you saw some of our exercises over there. I want to show you the functional Okay guys, so you saw some of our exercises over there. I want to show you our functional massage component. You can incorporate cross-friction massage if you like. Functional massage would be incorporating the movement with the compression, where you're approximating the tissues or elongating the tissues, where you're pushing distally or proximally, pushing up towards the joint or down towards your hand. So if we were going to target, say, our pronator here, we would start in elbow flexion, pronation or supination. You can start neutral, see what it feels like. I'm just doing straight compression here. Every time I straighten it, I release the pressure, flex it, pressure. So I'm putting pressure down while I'm extending it. You could try the opposite, but it's not nearly as effective as elongating the tissue while I'm putting the pressure. So I'm trying to align the collagen, increase blood flow, and just decrease the reactivity overall. So improving how it feels. So one way I really like to do it is to start in pronation and elbow flexion, push down, fall into supination. So I'm letting gravity drop my arm down. I can start full pronation, drop into supination. Then I can incorporate where I'm pushing down towards my hand just a little bit. There's just a little pressure. The difference is just minute little pressure away can totally alter what it feels like and can totally alter my results. And then I'll put a little pressure towards the joint where I'm actually directing my force more towards the joint while I'm compressing. Changing my wrist position, changing where I start. So I might do some with more elbow extension, or I'm just doing little mini ones. I can just do it right here. And then I can do some full ones. And finding where it's more tender, more discomfort, I can move towards that medial epicondyle, that bone right here. If that's where I'm having it, I can move into that flexor carpi ulnaris on the side. I can go up into the biceps. Wherever the case may be, I'm just finding that area, and then I'm just directing my pressure in a way that targets what's tender or sore. So this is an awesome technique. You can incorporate some cross-friction massage where you're just going across the fibers, and you can do that with a relaxed arm. You can do a little cross-fiber pressure while I'm doing the functional massage and the movement of the elbow. So, like I said, you can do it with wrist. I can just press, let the wrist fall. This is another variation. The elbow variation is very effective for the self-functional massage. We use the wrist mobility at the same time. A lot of times when we have a therapist or another person doing the functional massage, that one's very, very effective, especially if we take them to the limits of the range of motion, or close, I should say. And just moving around, finding a spot. You can even go into the belly a little bit. Whatever the case may be, but if you're experiencing pain on that medial elbow, just play around and feel what areas are tender. So if you stayed tuned to this whole video, I want to thank you guys for watching. Let us know what you think in the comments section. let us know if you want to see more about functional massage. If you do want to see more about functional massage, definitely let us know. We have done a little bit about it, but we haven't gone in depth to where some of our viewers may be interested. So if that's something you want to see, let us know below. And if you like those exercises, make sure to give us a thumbs up on the video. That tells us that you liked it. That tells us what content we want to be producing based on what our viewers are liking. So make sure to subscribe to our channel so you don't miss any of our videos. We got a bunch of big ones coming up, guys. Not things you're going to want to miss, but I don't want to give it away. So make sure to subscribe. And if you have any questions in the meantime and you don't want to drop it in the comments section, email us at overheadathletics@gmail.com or send us a message through the website. So thanks again for watching. We'll see you next time, guys.